Let's talk about indifference. How do you look indifferent? I was practicing this before the video. Like, what does indifference look like? I don't know. I keep wanting to do this with my hands. I'm not exactly sure how indifference looks like on your face. Becoming indifferent about our pain or symptoms is really helpful when we're trying to recover from neuroplastic pain or mind-body concerns. And in this video, really quickly, I'm going to explain 5 ways that you can start to cultivate the attitude of indifference. I don't know about you, but when I was in chronic pain, I was obsessed with the pain. I was tracking it. I had, worksheets that was tracking, what was triggering the pain, whether it was food or activity. And I was so fearful and frustrated and in despair about it. And like I've said before, I was probably thinking about my pain 80 to 90% of the day. And that's a lot. It was basically my whole world. But using pain reprocessing therapy to overcome neuroplastic pain or mind-body concerns, we need to actually start to cultivate an attitude of indifference. Now, this is really hard. By no means, I know I'm going to get a lot of comments about how difficult this is, and I empathize with that because this is a hard thing to do. But what we're doing here is we're doing the best we can to cultivate the attitude of indifference. We don't need to force ourselves to feel indifferent. Sometimes we need to start putting certain behaviors and thought patterns into motion before this attitude's actually cultivated. So here's 5 quick tips for how you can start to cultivate the attitude of indifference. Number 1, talk to your pain in an indifferent way. Tell your pain, I don't really care what you do. Feel free, be there if you want, but I'm going to enjoy my day to the best of my ability. This is a really useful thing to start doing, and talking to our pain in this way. It can actually start to lower the fear or frustration or despair that we have about it, but this takes practice. You're not going to feel indifferent right away. You're going to have to consistently practice talking to your pain in this way so that it starts to get the message that you don't really care what it's doing. Number 2, give your pain a funny name. The word pain just naturally is fear-invoking. It creates frustration, it creates despair. And so we need to actually name it something different. This is one of Dr. Schubiner's strategies that he talks about a lot. And I really like it. I used it when I was recovering. My name for my pain was Fred. I think that's a great name for pain. No offense to people named Fred, I just thought it was a funny name for my pain. And I would talk to Fred in this way and joke around with him. By doing this, we're naturally lowering the threat value, and it makes it more light and easy when we're communicating with our pain in this way. So practice this. Find a name that works for you. I've heard other people call their pain Fluffy or Pom Pom. But pick something that's going to lower the threat value. Number 3, focus on living your life again and enjoying it as much as you can, even though your pain or symptoms are there. This is a great strategy to create indifference about your pain. So often when we're having chronic pain or symptoms, our whole life is dictated based off of our pain or our symptoms. But the problem with neuroplastic pain or mind-body issues is your brain keeps getting the message that your body must be really damaged because you're avoiding everything in life. You can see what happens here. Your brain is just getting this message repeatedly that your body must be damaged. But the problem is that if your body isn't actually damaged, the pain switch stays on indefinitely. And so part of healing, a big part of healing, is starting to re-engage in life. We're not going to heal by continuously avoiding everything. Now you can start slow. When I was, there was a few months, I think 3 or 4 months where I was off work. and I had to slowly start re-engaging in life again. And as I did this more and more, I started to see my progress actually increase. I was improving day by day much quicker than when I was like isolated and hiding in the basement suite that I was living in. And so by doing this, by starting to live your life again, you're giving the brain the message that we don't care if there's pain. We're going to start engaging in our life and enjoying it as much as we can. Number 4, limit how much you talk about your pain. This one seems obvious, but people forget this because what I was mainly talking about with people in my life during my chronic pain was my pain. My friends and my family were always asking about it. Every conversation that I had with someone, I was updating them about the newest treatment I was doing and where the pain was now, what part of my body had it moved to now. And what's happening is we're constantly getting this message that our body's damaged by talking about the pain. And so by actually stopping talking about it, we can create an attitude of indifference that can actually help us heal. Now, of course, when I'm in therapy with people, we're talking about their pain, but I often advise people don't talk about it with family members or friends. And even when I was recovering, I remember telling my parents, I was like, I don't want to talk about my pain anymore. Don't ask me about it. Let's actually talk about other things. And I had to do this with friends as well. And by doing this, pain was becoming a smaller piece of my life, which is really important for your healing. And number 5, focus on your emotional state instead of your pain. This advice goes right back to Dr. Sarno, where he would tell people think psychologically, not physically. And so when I'm working with people, I'm teaching often that we need to learn to be in our body with our emotional state and learn to deal with our stress, deal with our difficult emotions, sit with them and create a sense of safety instead of being so hyper-focused on our pain. Because we are so focused on our pain that we don't even notice our emotional state underneath a lot of the time. But by actually focusing on our emotions and by learning to feel safe with them, the pain can actually start to reduce. So the final tip, focus on your emotional state, being in your body with it, instead of always focusing on your pain. So I hope this video was helpful in giving you some ideas of how you can cultivate an attitude of indifference about your pain or symptoms. So please put your questions or comments down below, hit the like button, and subscribe to my channel, and I'll see you all next time. Take care.